right? So before I get into the public health, Robert mentioned, do the risks, do the benefits outweigh the risk, right? So you're editing the gene, right? So it is possible, okay? It is possible. It's unlikely, it's rare, right? Every surgery has its 1% risk. Am I correct? There could be blood clotting. There could be something that happens awry. Do we all agree? Right? Um, and so with this sickle cell, so for 2-3 years, 2021, since 2 years it has happened, they haven't seen any off-target gene effects in any of the individuals that have gotten this curative therapy. Okay, down the line, can it happen? It's possible, right? If there's an off-target effect in the preclinical trials, they haven't seen any. Okay, they haven't seen any, but in the clinical trials, they haven't seen any yet either. But down the line, can it happen? It's possible, right? There is a chance. It's slim, but it's possible, okay? Depending on the disease severity you have, right? Some people, if they don't have so much of a severe disease, they're probably going to say, okay, well, maybe I don't have to get this. I'm living, a semi comfortable. It's not like terrible. But then there are people, right, who have very severe sickle cell disease, and this is the people who really want to, right? They are tired of living with a debilitating disease like this, and they go into the clinical trials, right? So it depends on each person. So as I said, yeah, there is a chance, right? And that's basically the only adverse reverse experiences they've had, as I said, is from the chemotherapy that lasts a couple days. But other than that, they haven't, right? But it's curative, right? So it's not something that's gonna happen again, like acute chest syndrome, sickling, like those are gonna be gone, right? It's a curative disease. So basically the only possible, not the only possible, but the major kind of risk is that, okay, 5-10 years down the line, what's going to happen, right? Is there going to be maybe an off target that happens after, right? Because we've done this in mice, in animal trials for 5 years. We haven't seen anything, but is it reproducible in humans? And usually it is, right? That's why we use animal studies. But so that's one of the major things that we have to look for. And the clinical trials, right? The clinical trials are also important, okay? So this is what I want to get to. When a community or any patient is doing a community trial, a clinical trial, informed consent is important, right? Researchers have to be very, very transparent. And if someone doesn't like the study or something, they've changed their mind, they should have the ability to drop out of the study whenever they want, right? So do you all know the Tuskegee experiment? Anyone know what happened in like the 1960s, right? So yeah, right. It's some very, very, very crazy, some really bad stuff, okay? Like this is terrible stuff. For people who don't know, I'm just want to give you a brief explanation. It was African-American military men, I think about 600 of them. And they were 300 had syphilis or 200 had syphilis and 400 didn't. And they were doing an experiment on them where they gave them like aspirin and like minerals to see how with like people with syphilis, if it like helps them. But there was therapy, there was penicillin that could help them with their disease, but they didn't give it to them, right? So are they helping that patient actually, right? In the clinical trial, are they helping those patients by giving them minerals and stuff? That's unethical, right? So if you're causing harm to someone in a trial, right, that should not be allowed. So it has to be transparent. And if the person who's doing the clinical trial decides to drop out, they should be able to drop out, and they should be given every single they should be given every single benefits and risks, and they should have the ability to decide for themselves.